In the next few days or weeks, you will be having gynecological or urological surgery. These kinds of surgery can produce swelling in the pelvic region. As a result, you may not feel the urge to urinate, or you might feel like you can't completely empty your bladder. This is referred to as urinary retention. While urinary retention is a frequent problem, don't worry, the condition is temporary. But until your urinary system returns to normal, you'll need to help it eliminate the urine in your bladder. The procedure that we will use is referred to as self-catheterization. Yes, I know it might sound a bit scary, but together we'll find out what it is step by step. I'll begin by describing the urinary system and the anatomy of the genital region. Then, we'll look at the materials needed for self-catheterization, and I'll explain how to perform the procedure so that you can do it by yourself at home. I'll also show you how to care for your catheters, and just a reminder, all the information in this video can also be found in the guide that you will receive. You don't have to remember everything in the video after just one viewing, because you can watch it again during your hospital stay as well as on the institution's website. Are you ready? Then let's get started. The urinary system includes the kidneys, ureters, urinary bladder, and urethra. The urine produced by the kidneys passes along the ureters to the bladder for temporary storage. When you urinate, the bladder contracts and pushes the urine through the urethra and out of the body. As a result of your surgery, your pelvic region may swell, making it difficult to urinate. That's why you have to learn to perform self-catheterization, which consists in inserting a small tube, the catheter, through the urinary meatus to your bladder. The urinary meatus is in the genital region. The genital region includes the clitoris, urinary meatus, vagina, and anus. The urinary meatus is located between the clitoris and the vagina. The catheter is inserted into this opening. Let's take a look at the materials that you will need to perform this procedure. A mild liquid soap, such as Dove or Cetaphil. Tap water. 2 washcloths. 2 or 3 hand towels, depending on the location selected. You can use a paper towel instead of one of the hand towels. Short urinary catheters for women. As you can see, the tubes are thin and flexible. The nurse will tell you which catheter to buy, how many you will need, and where you can purchase them. Water-soluble lubricant in a packet or tube, such KY or Muco. Be careful not to use Vaseline or a product containing petroleum jelly as a lubricant. Mirror. 2 measuring cups to collect urine. A pencil and sheet of paper, which will be given to you on the ward when you are discharged from the hospital. The sheet of paper is for recording the volume of urine collected during each catheterization. Syringe with a catheter tip. You can ask your nurse for one before your discharge. Otherwise, you'll need to buy one at a pharmacy. 2 plastic storage bags of the Ziploc type. Mark one soiled and the other one clean. And finally, dishwashing liquid. First, you need to try to urinate normally and collect the urine produced. You'll need a measuring cup. Sit on the toilet, position the measuring cup to collect your urine and urinate. After you have finished, measure the volume of urine in the cup in milliliters. Record the amount on your sheet. Dispose of the urine in the toilet and wash your hands. Pick a spot with good lighting where you will feel comfortable performing the self-catheterization. You can choose one of these three positions. Standing near the toilet, sitting on a chair facing the toilet or on the toilet, sitting on a bed with your legs positioned as if for a gynecological exam. To perform this procedure, it is important to choose a spot with enough space to place the following materials on a towel: liquid soap, 2 washcloths, a clean hand towel that has not been used, water-soluble lubricant. Remember that the lubricant cannot be Vaseline or a product containing petroleum jelly, mirror, urinary catheter, the other unused measuring cup for collecting your urine, pencil and paper for recording the volume of urine. Since you won't be using disinfectant or gloves for this procedure, you need to make sure that your hands and body are clean at all times in order to reduce the risk of infection. Once you have gathered all your materials together, wash your hands with liquid soap. Lather your hands and then scrub them for 20 seconds, making sure you clean between your fingers, the backs of your hands, and under your nails. Rinse your hands for about 10 seconds. Moisten a washcloth with tap water. Apply some soap and lay the washcloth on the end towel. Moisten the second washcloth with tap water and place it next to the first washcloth. Dry your hands on the unused hand towel and use it to turn the faucet off. Open the lubricant. Liberally apply lubricant to the rounded end of the catheter with the 2 openings. It is important that you do not touch this part of the catheter with your fingers. Put the catheter in the measuring cup. Remove your panties and get settled comfortably. If you have decided to use the bed, place the towel under your buttocks. If you are right-handed, use your left hand to spread the outer lips of your vulva. If you are left-handed, use your right hand to spread the outer lips of your vulva. You will need to keep your outer lips separated until the catheter has been inserted. Use the index finger of your free hand to locate your clitoris. The urinary meatus is located just below the clitoris. If you need to, use the mirror to help locate the urinary meatus. While keeping your outer lips separated with one hand, use the other to clean the area around the urinary meatus from front to back with the soapy washcloth. Use the damp washcloth, the one without soap, to rinse the area around the urinary meatus from front to back, and set the washcloth aside. Make sure the measuring cup is within easy reach. Grasp the catheter between your thumb and index finger and slowly insert it into the urinary meatus, guiding it upwards. If, during the procedure, you drop the catheter, allow it to touch anything, or if it slips into your vagina, you have to immediately set it aside and get a fresh one so that you don't introduce bacteria into the urethra. Liberally apply lubricant to the rounded end of the fresh catheter with the 2 openings and then start the procedure over. If you experience difficulty inserting the catheter because of a sphincter spasm, take a break, relax, change position, and start over. Once the urine begins to flow, continue inserting the catheter about 2.5 centimeters more into the meatus. That's about 1 inch. The urine should flow into the measuring cup. If that's not the case, reposition the cup. Hold the catheter in place until urine stops flowing. When urine stops flowing, apply slight pressure to your abdomen over your bladder to make sure that it is empty. If no more urine flows, slowly remove the catheter. If urine begins to flow again, stop removing the catheter and wait until urine has stopped flowing. Then, continue gently removing the catheter. The presence of blood on the catheter means that your urethra has been irritated. This should stop occurring after you have performed the procedure a few times. If the bleeding increases or persists, talk to your doctor. After you have finished, measure the volume of urine in the cup in milliliters. Record the amount on your sheet. Dispose of the urine in the toilet. Wash your hands using the procedure that I described earlier. Remember that it is important to use a different catheter each time you perform the procedure. You should perform the procedure according to a schedule. You can find information about the schedule and when you should stop using the procedure in the guide that will be given to you. The catheter must be cleaned after each use. You'll need the following items to clean your catheter: tap water, a hand towel or paper towel, the plastic bag marked soiled, and a syringe with a catheter tip. These are the steps to follow in cleaning your catheter. First of all, rinse the catheter clean with cold water. Don't let it touch the sink. Dry the outside of the catheter with a clean cloth or paper towel. Use the syringe with a catheter tip to push hair through the catheter to dry the inside. Be careful not to touch the rounded end of the catheter. Place the catheter in the plastic storage bag marked soiled. Wash the 2 measuring cups with hot soapy water. At the end of the day, clean all of the catheters that you have used that are in the bag marked soiled. Wash them one by one with soapy water, making sure that they do not come into contact with the sink. Once a catheter has been washed, rinse it and dry the outside with a clean towel or paper towel. Use the syringe with a catheter tip to push air through the catheter to dry the inside. Then, place the catheter in the plastic bag marked clean. Repeat the process with all the catheters. Wash the measuring cups with hot soapy water. Normally, you should replace your catheters every month. If, however, you notice that a catheter is soft, sticky, or too stiff, don't wait until the end of the month. Replace it immediately. You have just seen how to perform self-catheterization to drain your bladder. You may not have understood all the explanations or feel comfortable with all the steps involved the first time around. That's normal. You can watch the video as often as you need to feel comfortable with the procedure. If you have any questions, refer to this guide to find the contact information for the person to get in touch with.